My name is Aaron Gerds, and I'm the editor-in-chief of ASH Clinical News. Welcome to this month's From the Desk of. For our feature article this month, we are taking a close look at gene therapy for sickle cell disease. Sickle cell disease affects over 100,000 Americans and really is associated with significant complications, pain crises, and vascular events, namely. And that burden is carried by a patient throughout their lifetime. Up until recently, the only curative therapy for sickle cell disease has been a bone marrow or stem cell transplant. But of course, that comes with lots of complications such as graft versus host disease. Gene therapy offers a new way of getting a cure for sickle cell disease without a lot of the other complications that we see with transplant, and really represents a major advancement in not just the care of sickle cell patients, but healthcare in general. But of course, as many things that are new in medicine, it carries a heavy price tag. And the estimated cost of gene therapy is somewhere around $1.85 to $2 million for the therapy. And how do we balance that with the anticipated costs of various admissions and complications over one's lifetime? And the added survival that might come with that, how much does that amount to as well? And how do insurance companies pay for this? How do we rectify this as a healthcare system? Well, one analysis done by ICER really delved deep into the numbers of what it costs to care for a sickle cell patient over their lifespan versus what does the gene therapy cost, and really tries to balance these budgets out, if you will. So we're going to take a close look at that ICER analysis and bring it to the forefront to say, is this something that we should be implementing, and how should we implement it within our healthcare system? We also have an Advanced Practice Voices article on attending the ASH annual meeting. It's just around the corner, and some tips and tricks not only for advanced practitioners, but for anyone attending the meeting to try to get the most out of the annual meeting, our venture to San Diego this year. We also have a You Make the Call with our expert Abhay Singh, taking a look at a case of CHIP and how should we think about these mutations that we somewhat incidentally find. We also are featuring a Passions article with Dr. Joseph Toscano and looking at the trifecta of cycling, hiking, and winemaking. And on the heels of our feature article in September looking at MRD and AML, we have a news item, a blood article looking at MRD analysis in AML patients with a perspective by Dr. Andrew Bruner. So a really good read there that kind of follows up our story from September. So all this and more in our November issue of ASH Clinical News. Thanks for joining me today, and until next time, keep the blood pumping.